of process and all that. I'm just wondering, should we just treat whatever we can treat, but be prepared that things will get worse.
Okay.
All right. And there's also an issue of whether, let's say, she suddenly stopped breathing. All right. I think this is more for the nurses lah. Whether you all want them to start CPR or not. CPR literally means cardiopulmonary resuscitation. So we jump on the on the chest and start pumping the heart. All right. Home CPR never works. The reason is because even though they stop breathing, you bring them back. We don't have enough time to tube them. You don't have. There's no
So
skill to the hospital. All right.
You have enough time to bring the hospital.
I don't think so. So instead of just reacted, the patient actually until stop breathing and do a CPR, we just let nature take its course, allow natural death. Right? So
that's what you.
Yeah, that's what my suggestion is. Like if things happen, let it be, because I think she actually went through a lot already for the last couple of years, and for her for the last couple of months, not much of quality of life in terms that she's lying down. Yeah, there's a little bit of communication, but she's trapped in her own body.
Actually, it just occurred to me that we are now in March. The first time she noticed was April 2012. 7 years.
7 years.
7 years. Yeah, of course, the earliest quality of life was still there.
Yeah.
And only in the last 2 years.
2016, drastic. I mean, very drastic.
I think 2016 is the one that.
As late as August 2016, she was still able to have lunch outside. Remember, we were going for lunch.
She on my birthday, she had low sodium. And she was a bit weird, but she
still have dinner.
Got a cake for me and sibuk with uncle. That one was her hormones lah. Acting up because of tumor lah.
So can we ask the prognosis or timeline?
Okay. Although it affects the breathing, alright, it can, of course, it can start anytime, it can stop anytime. But usually they actually goes on for a little while, a couple of weeks like that.
Couple of weeks.
Yeah, slow decline and all that. So I also need to know whether it's infection or if infection is quite fast. But let's say it is clear the infection is just because of the brain. Okay, it can be short days to long weeks, because we don't know the center how bad is affected.
So it could be a matter of days or weeks. Weeks.
Weeks. Yeah. So that's the thing. It's like, because we don't know where is it and how big it is, but definitely the rhythm has changed, the breathing rhythm. So if the breathing rhythm has changed, because looking at the blood pressure, and looking at the pulse, looking at the breathing rate, everything is heightened, like all goes up. It's because most likely she's uncomfortable also. This can cause pain. The tumor at the back of the head can cause pain. So I think that's why you're saying the heart rate high, right? Remember 100 plus like this. So maybe we can give a try of a regular morphine to see because already on Panadol. If the pain doesn't control by Panadol, that's the reason the heart rate goes up. Maybe just a little bit more regular morphine to see if she's a little bit more comfortable, the breathing rate and the heart rate drop or not. Alright, but
low dose lah.
Low dose lah. The day I start very low dose, 2.5 only lah. Maybe we give 3 or 4 times a day and just observe if it is because of pain, the heart rate will drop.
To understand if it's because of it is caused by pain. Then you can see by that.
Because once you're comfortable, your heart doesn't beat so hard to compensate it anymore. You see. So if you're uncomfortable, the day was because the bleed. Once you have an upper gastrointestinal bleed, the stomach bleed, the heart rate will go up. But just now, Salina said there's no bleed anymore.
Yeah, there's no bleed.
Yeah. So I don't think so is the problem. The fever, but even when the fever dropped to 36, your heart rate is still 90 something. Yeah. So that's how we try to do very objective measuring. Okay, when this happened, what is happening? What do they do? So I feel that with such a big tumor at the back, I personally felt there is pain, headache. Headache, especially headache, where it is. So I think once we control the pain, she's comfortable, I believe the heart rate will lower down. So we try like about maybe 2.5 ml today for maybe let's try every 6 hours first. Okay, if you see the heart rate drop, that means last 2 days she was having pain. Then
because actually it's true that I suspect there's pain because she's like, breathing is that suara keluar tau. Then after that, after longer, and but with a voice, you know.
Yeah.
Usually your breathing, if you're snoring or you're just breathing hard, is different.
Yeah.
But this is breathing with a voice is usually
Yeah
pain
lah, we
and
suspect
pain
it's
lah.
pain because
Not
yeah,
sure, but
so we are
I
not
have a
sure
feeling
about
lah,
everything, but
yeah.
all these small changes, I think Melissa is the best to notice because now
Yeah,
she
yeah.
we know what is normal.
Mm.
Something abnormal happens, she will tell me when